Right now, school districts are caught in a massive contradiction. We're granting students more authorized mental health days than ever before, while simultaneously fighting record-high rates of chronic absenteeism. The logic behind the policy is straightforward. We assume that pulling a stressed student out of the classroom gives them a much-needed pause, a chance to decompress, reset their nervous system, and return ready to learn. But the clinical reality is often the opposite. When a student spends that day unmonitored and isolated, the time away rarely cures the anxiety. Instead, it often makes the thought of returning the next day feel more daunting. Every unstructured absence trades immediate friction relief for long-term behavioral issues. We are solving a difficult morning at the cost of the student's ability to remain in the classroom. This paradox creates two distinct outcomes. Our intended purpose is to provide space for reset and regulation. But without a clinical bridge, the actual outcome is an escape mechanism that leads directly to school refusal. Every approved absence operates as a specific policy lever. Without a clinical anchor, that lever often facilitates the exact systemic harm it was designed to prevent. The day off itself is functionally neutral. Its impact is dictated entirely by the environment and the actions surrounding it. We know a day at home backfires when it lacks human interaction. If a student spends 8 hours alone scrolling in their room with no conversation, the day functions purely as an escape, not as a tool for regulation. Clinically, this behavior is a leading indicator of school refusal, which is the primary risk of offering unstructured time away. Passive absences frequently mask the early stages of this refusal by framing the act of avoidance as a form of self-care. For parents, the stakes are high. Allowing a child to stay home without requiring a follow-up action step inadvertently reinforces the anxiety that kept them home in the first place. Without an adult asking what is actually going on, the mental health day ceases to be a restorative tool. It becomes a catalyst for chronic avoidance. School counselors and principals rarely have the time to conduct deep clinical evaluations for every individual absence request. Staff need a rapid, objective framework to differentiate between a healthy reset and a concerning pattern of withdrawal. This diagnostic process begins the moment a student requests a mental health day. The supportive path follows an absence triggered by a discrete, acute stressor, like processing grief, a sudden conflict, or a major life transition. To achieve actual nervous system regulation, this day must include an active touchpoint with a parent or a counselor to process the stressor. The concerning path involves absences that lack a clear trigger and function purely as withdrawal from the school environment. These absences often cluster around particular subjects, teachers, or specific days of the week. This is a clear indicator that intervention is mandatory. Tracking the context and the pattern of these requests allows a school to pivot from simple attendance taking to vital clinical triage. Approving an unsupported day off saves immediate friction for staff and parents, but it creates a dangerous administrative trade-off. That immediate relief eventually leads to compounding avoidance, which requires far more expensive and intensive interventions later on. Identifying a 30 to 60-day pattern of increasing frequency shifts the problem. It is no longer just student fatigue. It is an escalating psychological issue. Once a pattern like this emerges, traditional disciplinary or attendance policies are ineffective without a direct clinical referral pathway. Forcing a student back into the classroom without addressing the underlying anxiety only shifts the location of the crisis from the home to the school. A school cannot safely offer mental health days if they do not have the internal infrastructure to enforce follow-up care when that policy fails. The missing link in most district policies is the clinical infrastructure that bridges the gap between tracking an absence and treating the student. MentalSpace School provides this bridge by embedding licensed, diverse therapist teams directly into the school's support system, providing same-day teletherapy access for students in crisis. By integrating these clinicians with the existing school counseling team, the district creates a reliable referral pathway. When a counselor identifies a patterned absence, the student can be immediately connected to professional support rather than just being sent home. Because the root causes of avoidance are actually being addressed, districts using this integrated infrastructure report an 89% improvement in attendance and a 92% reduction in student anxiety. This system also handles the administrative hurdles of FERPA and HIPAA compliance and accepts major insurance, including Medicaid, at zero cost to families. It is also the specific infrastructure required to meet the July 2026 HB 268 deadline. This level of teletherapy integration provides the necessary risk management and legal compliance for modern school districts. The effectiveness of a mental health day policy is directly proportional to the clinical infrastructure backing it up. Episodic days off for acute stress reside in the low-risk zone. With moderate support and a simple parent-counselor conversation, these resets remain safe and effective. The danger zone occurs when we grant days off for patterned absences without a referral pathway. This creates a severe liability for administrators. Integrated teletherapy moves a district into the optimal zone, where high clinical support neutralizes the high risk of student avoidance. If a school pulls the policy lever to offer a mental health day, they must also provide the clinical infrastructure of the follow-up.